I won't believe I can be heard. Martin, confirm I can be heard.
I confirm. Please
All right,
proceed.
excellent. Thank you. So, karibuni everyone. This is a training session on the advancements that have been made currently on the SHA portal that we are, as providers, dealing with. KHF is providing the training through the team at the Ministry of Health. Our work is to midwife the process and ensure it's as bearable as possible given the challenges that come with change management. That being said, on the call with us today, we have Joyce, our Mishwe, and Linda Wambi, who have been gracious enough to spend the day with us. We had a couple of sessions in the morning, and this will be the last one of the day. We hope to have it run about for an hour, and we will ask that in the Q&As where you ask your questions. Joyce and Linda, feel free to answer them live as we move. Click on the answer live at the moment if given and done so that we are able to know it has been answered and we don't get back to it. Karibu sana for the to the floor. You feel free to share your screen. What I have picked is there is a need for demonstration on the maternity journey, medical cases and surgical cases as well. The rest we will deal with them as they come in the questions. Asante sana. Karibuni. Joyce or Linda, karibuni.
Good afternoon, team. My name is Linda Wambi, part of the support team. I'll be taking you through the advanced SHAPAT portal on where we are right now. In case of any questions, feel free to ask. So to start off, let me share my screen. Just a minute. So to start off, the first thing you need to do is to ensure you have the correct URL, which is portal.sha.go.ke. So once you click that URL, it will take you to this platform. So you'll be able to, let me just see if I can go back a bit. Oh, sorry. So once you click portal.sha.go.ke, it will take you here. If you want to learn more about the SHA product, just click learn more. These are the contacts. So this is the toll line. This is the email in case you have any inquiries or you need to be assisted. This is the support line. And then once you are fully equipped to this one, you're able to click login. With the login, you're given credentials. The credentials are being sent via email through that form that you have been filling. In case you have not yet received the credentials, feel free to share on the chat box. I'll be able to pick them. So you put your credentials, email, the valid email address, and then your password, and then you're able to log in. So once you log in, you have this beautiful screen that you're seeing here. So it has a menu, it has eligibility, claims, and authorization and pre-authorizations. This should be the most basic, the eligibility where you search the member, the claims where you're able to see all the admissions you've done for the day and for the year, for the month. This is where you check. And then the authorizations. This is the type of authorization that will be done, can be done via payer authorization or can be done via OTP. And then pre-authorizations, these are the requests that are being done in case you need an approval to be done that maybe the intervention requires a pre-auth. So maybe if I can start off, I'll just start off with the eligibility. I put my ID as a test user. I click lookup member. So once I click lookup member, ensure this is the correct the correct member at the facility with the correct ID that you have at hand, and then you can click view to proceed. So once you click view, you'll be able to see the loading contribution status of the patient. So currently, I'm still not able to be seen under the PHC and SHIF at the moment on the prod side, but on the test side, I think I can proceed. So it has to be green for you to be able to proceed to PHC and SHIF. So for now, such a person can only be seen under PHC only. So to start off, I can click maternity. I say view intervention. So with view intervention, I have cesarean section and vaginal delivery. So I can click cesarean section. I just say, so with this part, you're able to see the name of the interventions that are there, the access point, which is the inpatient, and if it requires a pre. So for this one, it does not require a pre-authorization. So for the CS, I can continue, I can proceed and click select intervention. So once I select intervention, the intervention will be added. So as you see here, and then I can come here and click start visit or admit. So once I click start visit or admit, I'll be able to start the visit via OTP or pair authorization. So with OTP, it's just the number. We have masked the 3 middle numbers for DPA purposes. And then for the pair authorization, this is how it looks like when I click pair authorization. So when you want to request a pre-authorization, the requirements are you put the location at where you are. So mine is just main location. Reason for the request, these are the requests that are here at the moment. So if it's an emergency, especially the emergency cases, and then if I want to add a note to the SHA team, I will just enter a brief note to the SHA team, and then I can choose file. So when I click here, I'm able to choose any file here, and then I proceed to start the visit. So let me go back to the OTP. So with the OTP, once I click use to authenticate, ensure you can just ask the member if this is the number, and if it ends with the last 3 digits, if it's 0719 and ends with 686, you're like, yes. So use to authenticate. So an OTP will be sent to the member, and the member is able to give you the OTP. So I'm waiting for my OTP. So my OTP has arrived. So I can verify the one-time PIN. So the admission or the visit has started. So to start off, there are things that are necessary to be done before you proceed, before you claim this particular visit. So there's add bill items, add invoice number, and then there's the diagnosis part and the billing part. The billing part has attachments. So I can start off with to enter the invoice number. So the invoice number is the unique identifier of this particular visit. So every visit or admission has to have a unique identifier. So when I press maybe this one, so maybe I have used this before, so that's why it's popping here. If I put now, let's say 0, and I save, so I can proceed. I can continue with the process. So I can continue to add diagnosis. So if the diagnosis is not there, you can search on the website. It will take you to WHO. You can add the diagnosis by name or the ICD-11 code if you know the ICD-11 code. So for now, I'll add by name. Just say this one. And then claim intervention. I save. I go to billing. I select file to upload. I can add, let me just see. I click upload file. So once I'm done, they're requesting me to do the bill items. This thing is still there, so meaning I have not yet finished my process. I can click add bill items. It will take me to the bill items, which is here, billing. So if I click billing, I'm able to put the charge type. I can say admission fees, the price, usually a package. So let me say 10,000. And then I save the item. I can go back again to confirm if everything is as supposed to be. And then I can proceed to bill. So I confirm again if this is the correct detail, and then I click I have confirmed that this claim has all required information and it's now ready to be submitted. And then I click complete and submit claim. I say yes. So that's the first part of the maternity. Can go back to the eligibility again. So once the visit has been submitted, it's taking me here. So for me to see that the visit that I was there, well, when you start a visit, it will be under pending. So it will always be here until the visit is submitted. So when you submit the visit, it will move from pending to sent. So it will be under sent. So this is the visit that I have submitted a few seconds ago. And then any visits that I have closed. So maybe I can just close one under pending. You see how it's being closed. I can view this one. Let me see the outpatient one. I can view and then scroll down and then say cancel claim. Reason for cancellation. I say no service given, and then I add, and then I say cancel. So the visit will be cancelled. So the visit will move from pending to closed. So this is where the visit will be. And if I want to search for any of the claims that I have done, either for the day, for the month, for the year, I can come here under all. Maybe it was closed or it was submitted. If you're not sure, you can just click all and then now search. You can search by the member number, say Linda. And you're able to see all the claims for Linda for the year, for the month, for the day. Yeah. And then you can proceed with whatever you wanted to do with the claim. So if I can go back to eligibility, I can search my name again. My ID, sorry, look up member, view. So waiting for the contributions to load. And then now I can go to Reno Care. It was Reno let me just go to IP. Inpatient, sorry. So I click the inpatient package, view intervention. So with the inpatient packages, I come here, I click management of medical cases. I select intervention. Once I add, I'm able to come here, start the visit. And then now this one requires a pre-authorization. So if it requires a pre-authorization, I'll just click OTP for me to receive my OTP first. I use to authenticate, an OTP will be sent to my phone. I'm waiting for the OTP. So the OTP has arrived, 3363. So if you put a wrong OTP again, it will not go through. That's it. So the admission again has started. So I'll be able to come here, enter my invoice number. Let's see. I save. Remember to save the invoice number. And then now, after I've set my invoice number, it's taking me to create a pre-authorization. So once it takes me here, I'm able to create a pre-authorization. This was not in the previous trainings before. So for today, this is what is new. So you create a pre-auth. So once you create a pre-auth, it will change to draft. So once I click here, I'll be able to add diagnosis. So this is the pre-authorization screen. From pre-authorization, you add the diagnosis, you add the billing, and any attachment necessary. So come here, add diagnosis. So again, you can add diagnosis by code or the normal name that you have. So I'll put this one as the diagnosis. I say save. So once I click save, I scroll down, requested amount, I put, and then note to share team, and then I save. If it's necessary, that is. And then now I come here, drop a file. So document type, I can say it's a pre-authorization form or a claim form or any form that is necessary for approval to be done. And then I scroll down, I click submit pre-auth. I hope that is clear. So here, submit pre-auth. So once I submit pre-auth, I'll wait for the approval to happen. As I wait for the approval, I'll be able to continue with the billing. So I'll come here, come to the diagnosis. So the pre-auth is still active, waiting for the approval to be done. Amount approved is yet to be approved. I say diagnosis. I add again either by name, etc. So add by name. I say this is the code, the diagnosis that I want. I click save. So once I'm done, you can add more than one diagnosis. So once I'm done, I can come here, I say billing. Now I want to bill the patient as I wait. So charge type, I say admission fee or doctor's fee, either. And then I say the 10,000. This is the claim intervention. So if I have more than one intervention, they will all appear here. So I'm able to bill against the intervention. Then once I'm done, I save the item. Oh, sorry. Charge type, doctor's fee. I put drugs. Click save item. So I'm able to see if the pre-auth has been approved. It has not yet been approved. Let me refresh. As I wait for the pre-auth to be approved, maybe I can be answering questions. So for this question on the Q&A, where on the portal can we see the PHC facility attached so that we can refer directly to them accordingly. So for the PHC, when you search a patient, I hope this is what you meant. So every package has its fund. So if it's PHC, let's say optical health, I'm able to view this package for optical health and view the interventions. So this is what, under this optical health package, this is what the intervention I am eligible for, the consultation and prescription and issuing of glasses. That's it. So how to admit, I'm not sure. PT, what is PT? Please specify the PT. Medical admission in level 2, how they require pre-authorization, and when requested it was rejected. How can you explain to the patient that despite having paid for SHIP, he or she can't be admitted? Maybe the SHA team can answer this one for John Duragu. Can you pre-auth at the point of discharge in inpatient medical cases where there's no rebate and you can't add amount at the point of admission? The best time to request for a pre-auth is when you're admitting, and then you're able to extend the visit to proceed with the next step to discharge the patient under the same visit. I hope that is answered. There are some I cannot answer. There are more on the SHA.
There is one that the one that you showed SHIV PHC cover. I think the question was on the portal, if I am seeing a patient and I need to refer them to level 4, where is the drop down or that then I click that refer this patient to that facility? Have we worked on that yet?
Not yet, not yet. You're not able to refer the patient from the portal, not yet.
Yeah, that was the question.
Okay. So maybe if I can check. Maybe you can continue with the questions that need the SHA team can answer as I check if the pre-auth has been approved.
Okay, so there are some that I've already answered in the Q&A portal. The rest are mainly related to the system, the SHA portal. Like at admission, you know, the place where we are doing delivery.
Yes.
And then we're indicating, we start pretending like we know whether it will be SVD or CS. I think we've mentioned this before. It needs to be changed so that it's based on the outcome. You under the maternity delivery bit.
Let me just go back there.
Yeah. And then people want to be shown the outpatient.
Okay.
Yeah, the
So
outpatient.
under the maternity?
Joyce, did you manage to get someone from SHA?
Let me just find out whether they have.
Okay, fair enough. Just let me know if there's anyone from SHA, they can chat us. We elevate the panel.
Yes, I'll let you know in the next 1 minute.
Linda, if you're talking, we can't hear you. Please unmute.
Oh, sorry about that. I was thinking we're waiting for the SHA team. Sorry. So the pre-auth has been approved. So once the pre-auth has been approved, the total requested amount will be, you had requested 10,000 and the approval amount should be 10,000 or less. So yeah, once I am done with that, I'm able to review and submit. Let me see if there's anything I've not added. Review and submit the claim. So I need to confirm everything is okay. So I can see I read, meaning I have not attached my invoice. I'm able to go back, sorry. Under billing, attach my invoice. I upload. And then I can review and submit the claim. So I need to confirm again if everything is okay. The amount, especially the amount, and the benefit type, which is the package inpatient. And then I can proceed to say I have confirmed, and then I can complete and submit. I say yes. So once I have submitted the claim again, it will move from pending to sent. And if I cancel the visit, it will move to closed. Yeah, so there was something that was being asked around maternity. I'm not sure if there's anyone who can give me clarity on that one.
The maternity one was just let's go and admit a woman for maternity. Now she wants to deliver. Then you will see it asking SVD, yes, like it's making us determine what will happen, yet we know that things can change. You can start with SVD, but then somebody proceeds to CS.
Like this one, the vaginal delivery.
Yeah, so just go through that.
Okay. So I'll start the visit. I'm waiting for the OTP.
So the question is,
yes,
we are starting a visit.
Yeah.
Starting a visit means that we've predetermined that this person is going to deliver vaginally. Yet,
Okay.
it may become CS. So we are doing this, like after doing all this, can we come back and change and say, no, it was actually not a vaginal delivery. What actually happened is a CS. That's the question.
I think that needs to be added on the system. That will be added in the system. How you can change an intervention from one intervention to another. Because the only thing you can do right now is add an intervention.
Yeah,
Maybe
so it's the same thing. It's the same thing as the inpatient, yeah? It's predetermining that this person will be admitted for 3-4 days. Okay. But then now, if someone is admitted for 8 days, where do we go and change? That's another question that keeps coming up.
So for the change of date, so on this other side, it will be more of extending the admission. So there will be extension of admission from the provider's end to the SHA team. So for now, there's no visibility on that on the UI, but anytime there's someone who is requesting for an extension of visit from maybe 3 days to 8 days, they can just copy the SHA email for them to be able to be assisted for now. Till maybe on Monday, we'll be able to give clear visibility on that one, if that's okay. I hope that is answered well.
Yeah, you have. So for now, what do people do?
They can email. I think email is easier than calling for this one, the customer service at sha.go.ke. They can email this, they can send the request through this email. It's easier for accountability, and even it's faster when you send via email those kind of requests for extension of the visit.
Okay, then there is a question on the invoice. What invoice do people use? I know we had dealt with this, but just go through it for this particular session. And at what time do you attach the claim form?
So the invoice, as I had said, invoice is the invoice or invoice number is the unique identifier of a particular visit. So once you have that invoice number or the invoice number can come from the HMAS or can come from the Excel that you use at the facility or a receipt number. So it's just a unique identifier on that particular visit for that particular patient, for that particular branch, for that particular day. So that is where you get the invoice number. I don't know if I've answered that invoice number part. And then now for the claim, you will put the claim form or the invoice after the visit is done, because that is when you'll get the full details of the patient and even the invoice you have billed at that particular moment.
So there is, of course, there is the issue of pre-authorization, dialysis. Perhaps you can go through that, indicating what people should attach under pre-authorization, because there are no pre-authorization forms. That is supposed to be digitally. So there's no pre-authorization form. But what is expected for people to attach? Can they attach a lab result, for example?
So for the pre-authorization form, is anything valid that you feel when you attach the pre-authorization, the form, it will be approved automatically. It might be everything that you've done at the moment is okay, but there's something that you need clarity on. So that is when you attach, maybe if it's a lab order, you can attach the lab request. If it's an MRI, you can attach the MRI that you had scanned. If it's a prescription form, you can attach a prescription form. So it's basically at the moment, what do you need to be approved?
So please go through the dialysis thing.
Dialysis is under inpatient.
Dialysis can be under outpatient and also can be under inpatient.
Okay, let me just click inpatient.
I think there was a module called renal package or something.
Oh, for the renal. Okay.
Yeah.
Okay. So for the renal, this one, click view intervention. So this for the renal, everything under this package requires a pre-authorization, as you have seen here. So I can just click hemodialysis, select intervention. So once I click select intervention, I'm able to either start the admission via outpatient or inpatient. So do you want me to start via outpatient or inpatient? Can start with outpatient. Let me just say outpatient. So with the outpatient, I can be able to start the visit. Again, an OTP will be sent. Just authenticate. Waiting for the OTP. So once I start the visit, I'll put the invoice number again. I save. And then it will ask me to create the pre-authorization. So I'm able to see the tariff, that the remaining balance, and then annual quantity limit and the usage frequency, sorry. So I can create a pre-authorization under the specific tariff. So create a pre-authorization. We click draft. So already it has given me the amount. So I'll add the diagnosis, save. I'll put the necessary attachments again. Open. Document type. Can put pre-authorization form. I save the file. Once I am done, I'll submit the pre-auth. It should take roughly around 5 minutes to be approved. So yeah, once I'm done, I'll be able to bill as I wait for the amount to be approved. So diagnosis, I can add the diagnosis. And then save. I can add the billing. I see the 10,000 that I requested. It was around 10,650. And then save the item. You attach. I upload the file. As I wait for the approval to happen, I check if everything is okay. So the approval will take around 5 minutes. So maybe I can be answering questions.
So there is a question on, again, where do you get the invoice number and the patient has not been billed, or is it SHA invoice number?
So for the pre-authorization, it's not a must you put the invoice number. You can just proceed because at the pre-authorization level, you're only just requesting for the specific intervention, and then now you can proceed to bill. So you cannot bill without a unique identifier. I don't know how facilities will bill without a unique identifier. It can be a patient number, something to identify that particular visit.
Then there is another one.
Mm-hmm.
I don't know. I think it's, do we proceed to when the profile is not complete? I think that question is incomplete, but basically, I think it's more of when the profile is not complete, how do we proceed?
Which profile? The patient's profile.
Yeah, I think so.
They need to go to Afya Yangu.
Yeah.
Afya Yangu to complete first the registration process. And if it's a dependent, they need to add the dependent so that they can come back here because the addition of the dependents or addition of any information is real time.
Yes. Then there is someone asking, they have received the logins, but when they try to add ICD-10 code, there's like 7 that are recurrent in the system and you cannot change that. So first I wondered, are we using ICD-10 or ICD-11? I thought we were using ICD-11.
ICD-11.
But then now I don't know what, there's like 7 that are recurrent in the system and you cannot change that. So that one is a bit unclear. So Isaac, perhaps you can clarify a bit more. Then there is a bit, he goes further to ask how to bill. The bill items on the system are for Nokia package. How do you do the billing?
I think we have done that.
Yeah, but you can repeat for purposes, maybe, yeah.
We are still waiting for the price to be approved. I cannot start another one unless I just start an intervention under the same what do you call it, under the same package. Unless I just add an intervention.
I think what he is requiring more is a clarification, like, you know, how you just talk about billing and then the billing items. There is a question that keeps on coming around that area.
I don't think I have gotten the question. Around the billing area. Let me just come here.
How can you bill without approval?
So you'll have to wait for this is a test site. That's why I was just filling in to wait as I wait for the approval to happen. So you need to wait for the approval. The approval will happen after, I think, after 5 minutes, 5 to 10. So once it has been approved, that is when you can proceed from here. So for now, I was just filling in because it's a test site, but you'll need to wait for the pre-auth to be approved. And then for the billing, let me just go back to the billing.
So this word pre-auth inachanganyisha watu because
it's a pre-approval. It's a pre-approval.
It's a pre-approval,
yeah,
but in some places, okay. You know, some people are getting confused. Is it happening before or after management? Because like if it is about admission, you cannot quite tell how long somebody will be admitted. So even as you put in how much you think will be spent, you can't tell. So that pre-bit of it is what is. So supposing you put in a pre-auth for 4 days, but this person now needs to stay in a facility for 8 days. That is what is confusing people.
Okay, I had mentioned earlier. So pre-authorization is a pre-approval. So you're approving, you are requesting for approval before you attend to the patient because you're not sure about the amount that the patient will use. So you can just say you are requesting for the 10,650, but as the time goes, you want to request another amount. You're able to add under that pre-authorization. Let me see. So we are able to add a bill here under interpretation. Let me see. So let me first wait for the approval to happen. Let me see. It's taking quite some time. Also, if I can get someone from the SHA team, what happens if the person has exhausted the required tariff? Maybe the SHA team can answer that question.
So there is someone called Pius. Has he joined? Has Pius joined? Kamau. Dr. Theory, can you see somebody called Pius Kamau so that you can elevate him to be a panelist?
Let me check for him.
Thank you.
That's done.
Okay, yeah, he's here.
Okay, thank you very much. So Pius, karibu sana. There are several questions for you. Linda, you can start.
Oh, my question was, what happens when the requested pre-authorization has reached the overall tariff for that particular intervention? Do the patient has to pay for cash, or will they require to add another pre-authorization under the same visit?
Kamau, please say hi, first of all, so that we just know that your Nini is working, your voice. I think he's having issues connecting.
Mm-hmm.
Hello, I mean.
Yes.
Yes.
So yeah. Did you hear the question Linda asked?
Kindly, can you bring it up again, please?
Okay. Linda?
So my question was, once the overall tariff, the patient has exhausted the overall tariff when they were requesting for a pre-auth, what happens after this? Now, for example, the hemodialysis, the overall tariff is 10,650. What happens when they have exhausted this and the patient is still at the facility and is admitted? Will they require to add cash, or will they require to be requested for a pre-auth, and how, or something like that? How will you assist on that one? That question.
Okay, when somebody with a chronic illness has exhausted their chief allocation, then they'll be able to access the ECCIF fund, that is the Emergency Care and Critical Illness Fund. So that is what we should now work on to see how they'll be able to transit to that now. So once somebody with a chronic ailment, let's say dialysis, requires hemodialysis. So once they exhaust their repeated sessions, which is I think 2 per week, then they should be able to access that ECCIF fund. Thank you. Over.
Okay.
And
Joyce?
then the other question that is coming up is for walk-ins at level 4, what happens? And they're coming to seek primary health care services.
Okay, the way it has been designed is that it will be on referral basis. That is that is to access services at level 4, 5, and 6 on referral basis. And again, you need to remember that level 4 facilities are the hubs when it comes to primary healthcare. So I think more training on the same on how to access this needs to be shared so that our members can be well acquainted on how to access services. That is how they can access services at level 4 facilities. That is from level 2.
So what is the guidance? When people show up at level 4, they are chased away? That is the question that people are directly asking.
You are not clear.
Okay, so as he's working on his audio, Linda, the outpatient, level 2,
Yes.
level 3.
Can access, but they should be able to access services, especially those with the critical illness.
Mr. Kamau, you're not clear.
Pius, we can't hear you. Perhaps if you're talking, perhaps you could unmute. Else you can maybe type your question on your answer on the chat. Linda and Joyce, please proceed as we're waiting for Pius.
So I think this question has been answered. How do we put here? For the referrals, this is not yet done on the SHA portal. Maybe if this can be answered by Monday on where we are on the referral process. So anyone that has not received the credentials, you can email this you can send your request to customer service at sha.go.ke if you have not received. And if you have not yet filled the form, kindly fill the form first before you send the email that you have not received the credentials, because the credentials are being sent by email. You might also try and check on the spam under your emails. Just check all emails and then click spam to see if the email has come from there. So if your credentials again are not working, please send your request to that email so that we can be able to check why they're not working. Please also specify the error that you're getting when you try to log in. So let me just... trying to check questions. So there's this question I'm not sure who is able to answer, which is the procedure for making contributions for SHA. If a person defaulted under the NHIF, will the default carried forward to SHA? I don't know who is...
Okay, so that one, there is no carrying forward to SHA, the default. What is carried forward to SHA is if you had paid for a considerable period of time, maybe you are those people who pay premiums for 2 years, the money is what will be forwarded to SHA. But the default history will not be forwarded to SHA. What people are expected to do is go to the web portal, afyayangu.go.ke. If you're employed, it will ask for employer byproduct. I mean, it will try and sort that out. But then if you're not employed, it will take you to a means testing portal, and then you answer a few questions, and then you're told how much you should pay. For that category, the law says you should pay premium for a year. But for now, my understanding is that it's been made a bit lax so that even if it's for 1 month, people can pay. And then now the how to pay, there should be a pop-up message, but I understand today it's giving people a lot of problems. So you can also then now move to *147# and then indicate that you want to pay. So that is, now if you're unable to pay, kabisa, and the means testing indicates you're an indigent, then that one the government will pay.
Another question was about the civil servants. The contract was extended to November 21st. How sure are we that we will be paid since Hicks was passed away?
That one, Kamau, please respond to that.
Okay, the HIC system is still there, and hospitals can be able to access it to see the managed schemes that are still running under the department. So for civil servants, if you want to see their limits, their details, mainly use the HIC portal for that. Thank you.
Okay. So there's this, maybe you can iterate. Does it mean that level 4 will be waiting for referrals only?
So, under primary healthcare, access to level 4 is referral. Anything that is allowed is the diagnostic test. That is for hypertension, diabetes, sickle cell, such like. So, for level 4, access is for primary healthcare. That is basically outpatient, strictly on referral basis. Again, done within the PCN. Thank you.
Okay. And I'm not sure who will answer this. How do you process a patient without a telephone number? So on my end, you can request the patient. If a patient does not have a phone number, I'm assuming it's a dependent. So maybe you can request the pay authorization. This part that we have been talking about severally. But if the client does not have a phone number, kindly go to Afya Yangu to register the client's phone number. And there was this question around where you get if the patient does not have, what was the question? There was a question around if the patient's phone number has lapsed or something. They want to change their phone number. Where do they go? I'm not sure how to answer that.
So on the SHA portal, afyayangu.go.ke, there's lots of edit options. I mean, the edit icons are all over. So that is the place you go to. But Kamau, please respond to that also.
Okay, kindly come again, the question.
Okay, so they were asking if a member wants to change their phone number, how do they go about it?
Well, that one I need to consult and find out. But maybe more information regarding referral. For inpatients, I've been advised that level 4 facilities not require referrals for them to admit patients. Thank you.
Back over to you, Joyce.
But perhaps could you check on your connection because we can barely hear you. Pius, can you hear me?
Yes, I can hear you now. Yes.
Yeah, please check on your connection. You could also just drop and connect again because we can barely hear you.
What about now?
Much better.
Okay, thank you.
So what he has said is for level 4 and above, the admission as an inpatient does not require a referral. Pius, is that what you said?
Yes. That is the position. Yeah. So level 4 facilities for admission, that is for inpatients, they do not need a referral from a lower level for them to admit. Okay.
Okay.
Over.
And on there's a question around. Let me just answer this part. Kindly assist when completing my OP claim. I get a feedback that the invoice has no bill items. Kindly ensure that you fill all the bills. There's this part. If you have not filled the bill items, it will not proceed. Please ensure that you fill everything on that portal for you to proceed. If there's any question, there are branch managers that have been allocated. You can be able to direct the questions to them.
So Pius, please elaborate on level 3 outpatient and ANC clinic and maternity.
Thank you. So the ANC clinics and the PNC clinics, those ones are to be accessed at level 2s and level 3s. Yes, and for delivery, again, delivery level 2 facilities which can do normal delivery are allowed to do normal delivery, but for cesarean section, that one, the facility has to be a level 3 and above, because we expect a level 3 facility to have at least a minimum of a maternity theater. Yes, thank you.
So Pius, if a patient comes, they are in labor, they have not registered with SHA, what happens? How does a facility make a claim? And I can see even on the chart that there is one facility that's undergoing such a thing. They now want to go in for an emergency CS. What happens? Is there a period that the claim can be made now once maybe the woman has delivered, she's calm, then now the registration process can happen, and then they can maybe is there 24 hours then for a facility to raise a claim for such a thing? Over.
Okay, the matter is to do with the notification of that delivery or that maternity case, and not necessarily raising a claim. So, if an expectant mother shows up at the facility and they're not registered, so the same way we're handling Linda Mama claims, that is the registration is done at the point of service, and then they are taken through the PMT. Then, if they're eligible, if they require government assistance, then the PMT will show that. During which, at the same time, the expectant mother should be getting the necessary services that they require. If it's a delivery, if it's a cesarean section, then during the admission process, then they do that notification. So here we don't have a waiting period in the way we used to have a waiting period under the defunct NHIF. So now they can register on the spot and get to access the service at the spot, provided they follow the due process. Thank you. Over.
So Pius, the question is, a woman has shown up today, now. She's not registered. She's in labor. They're taking her in for CS. This facility is worried. It needs to raise to raise something, but they don't have credentials. They don't have all those things that you've talked about. What happens?
Okay, on the matter of the hospital not having credentials, there's a Google form which has been going around where healthcare providers have been filling so that they can, it's a request form for credentials. So first, we'd like to urge that we ensure that our peers, or rather healthcare providers, without credentials, they fill in that form so that they can be issued credentials directly to their email. So the credentials will be sent directly to their emails. With respect to about the expectant mother showing up, we had shared a claim form earlier to all hospitals through email, through the branch offices. And that claim form is supposed to assist, because it's a physical document, it's supposed to assist in such situations whereby the hospital is not connected in any way, that is, they have not been enrolled formally. And they have signed the contract and they need to see this expectant mother. So they will use the claim form to launch a physical claim. That is a stopgap measure which has been given to ensure that all people access services at these hospitals. Thank you.
Okay. So in terms of, okay, so there is someone saying we didn't finish up on maternity admissions. Kindly show us how to go about it. Linda.
Pardon, please repeat.
Sorry, someone says that we didn't finish on maternity admissions. They need to see that.
The maternity. Okay, let me just close this visit. So for the maternity via intervention, I'll choose either cesarean or vaginal delivery. So as we have discussed, we are seeing how we can interchange. We'll be able to interchange the intervention in between a visit. So for now, I can just choose the cesarean section. Once I click, it will be added. I click here, start visit or admit. And then I'll notification be sent to my phone. I click use to authenticate. So I'm waiting for the pre-auth, or for the code, sorry. So the code is here. So I'll be able to see the overall tariff for the 30,000. And then I'll come here. So it does not require a pre-auth. So I'll just proceed to bill the client. I put the invoice number. I save. And then I click diagnosis. I add the diagnosis. I say save. I click billing. I say charge type. I can just say or admission fee either. And then I just say price. I put the one on the tariff, or if it's less, I just say 30,000. I say save item. I come here under the billing. I do the attachment. And then I say open. I upload the file. So once I'm done and I'm sure everything is okay, you can just proceed and review and submit. So if everything is okay, I'll say I have confirmed. I can check even the amount, that this claim has all the required information, complete and submit claim. I say yes. That's it. Back to you, Joyce.
Yeah, so there is someone saying they have done the pre-auth approval, but they cannot see where to click to submit.
So
where is the review and submit button in pre-auth? That's the question.
the review button. Let me see if this one requires a pre-auth. So yeah, if I create a pre-authorization, so it will be under draft. So I click the draft part. This is the part where you submit a green button. So once you just scroll down, you'll be able to see the submit pre-auth. It's a green and a very long green line called submit pre-auth. So you'll be under the pre-auth section. Just scroll down. Scroll down. Once you're done with the attachments and the filling of the form, just come and scroll down here and you'll be able to click submit pre-auth.
I think the question is, are you able to preview before you submit?
No, you're not able to preview like the other one for the claim part.
Oh,
yes.
Maybe that's something that.
Yeah, we can. It's a nice thing.
Yeah.
Yeah. Okay.
Kamau, please talk about rebates. That question keeps on coming up. The rebates.
Okay, the rebate is what is being referred to as the per diem rate. And that one is applicable for inpatient. And it's varied from level 3, around 3,000, like that. So it is part of what I was gazetted in that gazette notice that had the benefit tariffs rates. Thank you. So maybe what exactly about the rebate is there? Thank you.
So in the morning, there was someone saying they're at Nairobi Hospital and they're being asked to pay for the rebates. Right now, I'm trying to get, there's a specific issue. Let me just, there's someone who had written something. You can also go to the, there's someone who has just asked, do one for rebate. An example on the rebate story. Linda.
Sorry, I was on mute. If I'm not wrong, it's this one, the payment type, it's per diem, it's the same as the rebate, right? And it's what we've been doing all along.
Yes, yes, that one.
Okay, this is what we've been doing all along. So, like, this is the management of medical cases, and we have done it like a few minutes ago. Unless I'm not getting it correctly.
Then I'm also seeing, as I look for that specific question with on rebates, people asking about, there's someone asking about, can we do a demo on mental health? Something to do with mental health. Kindly do a demo, admission for rehab for patients who need rehabilitation for alcohol or substance treatment.
So this one can just click to do intervention. The process is just the same. The only thing that is changing is, so maybe if I click select intervention, the only thing that is changing is the type of package and the intervention. So when I come here, let me just go back. So every package has its intervention and what the patient is eligible for. So if it's mental and substance, if I view the interventions, this is what the patient can only be seen. Now that is me, management of mental health cases after exhaustion. So it really depends on the type of intervention you're eligible to be seen for. If I'm not wrong, Mr. Kamau. So the process is just the same of submitting the claims. So they just click here and just say start visit and then proceed. Yes?
Sorry, come again, please.
So I was asking for the like right now here under the mental health and substance abuse, if I'm eligible for more than this one intervention, they'll be able to be under this specific package for the mental health and substance abuse. Did you get my question?
Sorry, maybe you could be a bit clear on the question.
So I'm asking, under this specific package for mental health and substance abuse, if I'm eligible for more than one intervention, they will be under this list, or it's just this one under all the interventions under this package is just this management of mental health cases. That is my question. So maybe if it's someone who has paid, who has higher premiums, maybe there's more than this intervention at this particular package.
Okay, maybe for all members under the authority under SHAM, they'll all have equal access in terms of benefits. So irrespective of the level of premium they're contributing per year, So all of them will have equal access to the services. So in terms of what is under the mental health package, again, we stand guided by the tariffs that were gazetted the other day. Yes, thank you.
Okay. Back to you, Joyce.
Okay, so people are saying they are still not clear about the walk-ins at level 4 and above. And I think, Pius, you just please explain that level 4 broadly, what is being paid for and what's not being paid. If someone walks into a level 5 and then they need inpatient, does that mean for the consultation at level 5, they will cash? Then if they need some lab investigation that is maybe for diabetes, that one may be covered under shift, and then the inpatient is under shift. Explain that, a part is not clear. Over.
Okay, thank you very much. So with respect to the primary healthcare fund, the way it was, the way we were doing outpatient under the defunct NHIF, members used to select a single hospital where they could access outpatient services. So, and we used to capitate members to a single facility. So now under SHAM, under the primary healthcare fund, we have members being tied to a PCN, which is basically within the residential area. So with this setup, members are, in terms of accessing outpatient services, it is portable. They can access any facility within that PCN. And payments to the PCN and to the facilities will be done at the end of the month, depending on how, depending on the type of visits the members have been making to that PCN. So in terms of the level of facility, the PCN has level 2, 3, and 4 facilities, with the level 4 being the hub to the spokes, and the level 2 and 3 being the spokes. So under the PCN arrangements, members can only access primary healthcare, specifically outpatient services, at level 2 and 3 within those PCNs. So if they have to be referred for maybe a specialized test, maybe for diabetes or hypertension or sickle cell, then they can be referred to a level 4. If that level 4 does not have capacity, they can be referred to a level 5. That is on outpatient basis. Okay. When with regards to inpatients, the healthcare provider does not need to have a referral. I mean, the patient does not need to have a referral from a lower level facility for them to be admitted in a higher level facility. Okay, so if they go to a level 4 facility as a walk-in and they are required to be admitted, they don't need referral from a lower level facilities. That is under under inpatient. So under inpatient, they can just walk in to a facility, get admitted, and the authority will process those claims under that visit. Okay, but for primary healthcare, initially when we used to do capitation, members were tied to one hospital, and if you went outside that hospital, then you are made to meet the cost of that visit out of pocket. Okay, but now under this arrangement, they can access any facility within the PCN network within their locality. Thank you. Over.
So Kamau, so if someone walks into a level 5, as long as they're at casualty and they're doing consultation, they will pay out of their pocket. That's the question.
So if that is an outpatient scenario, then they'll meet the cost out of pockets. If it's an inpatient scenario, that is, they've been admitted, then the cost will be borne by the authority.
So the cost of, you see, you go to outpatient, you have to pay consultation fee. Then now when you're seen by the doctor, you're then told you need to be admitted. So SHIF will pay from where? Will, you know, that's the bit that needs to be clear. Will it pay now, including even that outpatient cost that has been borne on your way to being admitted, or it will only pay from where now it is said you have been admitted, then now it will pay for all that?
Okay, and in patients, the liability to the authority begins on admission. Once there's a notification reason in the, done in the system showing that this member has been admitted at this date at this time. Okay, then that is a notification for admission. So that is where the liability to SHA will begin. Okay, so if it's an outpatient visit, then the moment it is notified as an outpatient visit, then it has to be within the PCN network. Otherwise, referral procedures have to apply for that member to move from that PCN, to move from the PCN maybe to a higher level facility. Then in that scenario, then referral protocols have to be there. But if it's a walk-in and they go to a level 5 facility, so liability to the authority will begin once the system has been notified, once the authority has been notified that this member has been admitted. So we work from the date of admission moving forward, or from the time of admission. Over.
Okay, thank you. Then there is a question on kindly explain. So this whole, excuse me, this whole business of of a woman is in labor, the closest facility to her is level 4, 5, but we are talking of first she needs to go to a level 2, 3. So if she goes to that level 4, 5, which is closest to her home, will what happens?
Okay, for delivery services can be done from level 2 facility to level 6 facility. That is for delivery. And again, we all know that when a mother goes to the facility to deliver, maybe she'll be there for a day or two. So that is a straight up admission case. So in such a situation, they don't require referral for them to be able to deliver in a facility. So they can just go to any contracted facility which is near to them, and they'll be able to be assisted. Thank you. Over.
Yeah, because at the end of the day, those kind of scenarios don't know levels, so that is fine. Then
let's not forget the Q&A. I think we're tackling the questions. We also have other ones, the questions, and the question and answer part.
Yeah, I'm following both sides.
Okay.
Yeah. So a lot of level 2s and 3s operate Monday to Friday, 8 to 4 p.m. What happens on a Saturday? There is no that level 2 and 3 for referral. Then what happens?
Well, the arrangement we have with the healthcare providers is that they'll be offering services on a 24-hour basis. And in the event they don't operate on a 24-hour basis, they need to ensure that there are mechanisms to ensure that patients are either referred or taken care of at other facilities. So the contractual agreement we have with the hospitals and the healthcare providers is that they operate on a 24-hour basis. And again, in every locality, we expect there's a government facility, that dispensary or a health center, and these normally operate on a 24-hour basis. Over.
If the facility has not signed SHA contract, can they offer extended comprehensive NHIF services now under HICS? That's interesting.
Well, the defunct NHF contracts, all of them lapsed on 30th September. So as we speak, there's no contract, there's no NHF contract, which is active. So any facility which is operating under the old NHF contract, then they should know that those liabilities won't be honored. Okay, because right now we're only working with facilities which have signed the SHA contract, that is a Social Health Authorities contract. So that is a position regarding NHS contract. Yeah.
Okay, what will happen to patients who have been on follow-up with specialists and visit the facility on monthly basis? So somebody maybe has been already going to a level 5 for their diabetic care. What happens? Are they expected to slide back down, then now be referred to go back up, or what happens? Or do they just continue up there? Over. Kamau, please, for that one, what happens?
Oh, okay. Sorry.
Yeah.
Regarding patients with chronic illness, well, the authority is developing or is in the process of developing a database for patients with who require assistance with chronic illnesses. And to build up this database, we require this data from the ground up. So as a start, they can start by maybe visiting their PHC network. Then from there, they can be referred upward. That way we get to have the database built up. But from there, from that point, after being referred, they don't need to go back to their level 3 facility or their PCR network facility. They can be get drugs and their tests for chronic ailments at the preferred level. Over.
Okay, so I'm just seeing some queries based on how we answered the question about the NHIF bit, and people are really asking about the civil servant thing based on the circular that extended it up to 21st November. See that one tutaendelea kutumia Hicks up to that time, just for that one.
Okay, for hospitals which are still which are currently using Hicks, the contract which was extended was a civil servants contract between the social authority and the government of Kenya through public service. That is a contract which was extended. So the NHF's contract between NHF and the hospitals, that one expired on 30th September this year. So moving forward, we're only operating with hospitals which have signed the social health authorities service provision contracts with healthcare providers. So those are the hospitals we are working with. So if there's a facility which is operating and seeing civil servants, and they have not signed the SHA contract, then those those liabilities are not borne to NHF, because we're only working with facilities which have signed the social health authorities contract, that's the SHA contract. So those are the hospitals which we allow to continue using Hicks to see civil servants and other managed schemes. Over.
So there is a question that kept on coming up. Can someone encounter an overlap? Can someone encounter an overlap in case of an immediate outpatient, then inpatient visit? If the condition of the patient will be managed fully in the outpatient, will both of the claims be paid? I think this one came up earlier. So outpatient, then inpatient. So what happens in terms of claims?
Ms. Wame, maybe you can share if the system will allow overlaps. Thank you.
Then as we are talking, there is the question about the SHA contract. How was the SHA contract signed, online or through a physical paper? Please talk about the contracting process.
Okay, thank you. Contracting for healthcare providers began with a listing of licensed facilities by the Kenya Medical Council. So once the authority was given that, once SHA was given the list by the Medical Council, that is KMPDC, the list was sent to the NHF board and it was empaneled. And out of that empaneled list, we were able to send that listing of all those hospitals to the branch offices, that is the SHA branch offices, and they were required to send those contracts to all hospitals that were in the list provided, because we shared that list within our SHA regions. That is Southern, Coast, Northeastern, Central. We have Western, North Rift, South Rift, Nairobi region. So we shared the list to all the regions. After which the facilities were to print the contracts, sign and return physical contracts in triplicates. That is the 3 signed original contracts. So those are the contracts we gave the facilities. That was when this month began. Over.
Okay. Somebody is saying this is so confusing. I don't know what's in. So kindly take us through the inpatient discharge. Now you want to discharge a patient. Linda.
So for the discharge, nothing has changed. It's just you'll be able to extend this pre-auth, which we are not yet availed on the UI. So you'll be able to extend a pre-auth. Once you extend a pre-auth, you'll be able to tell that this is an extension under admission, and then now from there you can just submit the claim. So the admission part is here up here. So it will it will change to end visit or discharge the patient. So it will be end or discharge. So this is where you discharge
Please share your screen. Linda, please
Oh,
share your
sorry,
screen.
Sorry about that. So the only thing that has not been updated is where here when you say complete claim. So here at complete claim, it will change to discharge. So this is where you discharge the patient, either inpatient or outpatient. So this is the button. It's the same as here, complete the claim. So it will change from complete claim to discharge for clear visibility. So there's nothing unique about the discharging the patient. It's just this button. So this is like completing the visit, either for the outpatient or the inpatient.
Okay. So, some of these are KMPDC related issues. We've noted them. For you to get credentials, Linda, please tell people what they need to do.
So use this email. First, there is this form that you're supposed to fill. Let me just a minute. Let me look for that form. Let me look for that form. I share the link. So the first process, I don't know where to share. Should I share? Let me share under chat. So it will be under chat. So this is the form. I hope it's clear. So once you click Linda, how I wish you'll take us through the inpatient claim. This video has been recorded. We have been doing several inpatient claims submission. Maybe Joyce will let us know when the video will be available, so you can be able to just go back and check how to do how to do a visit under inpatient, and also how to do a visit under outpatient. Kindly, if you'll allow me to tell you to go back to the recording after Joyce has uploaded. So once you click I have shared the Google form. Once you click that Google form, you'll be able to fill in all the details. And then once you fill in all the details, in case of any question or any inquiry, please put the information under this email. just to say you try to log in, but you're not able to log in. You fill the form, but you've not yet received your credentials. Let me just copy this email and put it on the chat. This one. So, or you can even call that number, that toll number. You'll be able to get assistance. So, Beatrice, if you could end, Joyce, sorry, if you could end at this juncture.
Yeah. So we've managed to handle a lot of questions. Some of them we were answering live. What I feel is the discharging of the inpatient bit is something that is an issue. The credentials, please use that form, or where you find your facility has been wrongly placed, use that form, send it to that email. And then Pius, thank you for coming. And I'm sure Dr. Theuri and Martin Shege will tell us how to access the recording of what we've just done. Thank you very much. Over to you, Dr. Theuri.
Well, Dr. Theuri is connecting for this recording. Just pasted something on the chat. Just a minute. About 30 minutes from now, we'll have the recording, that link on the chat. So in case you need to refer something, please click on the link and then you'll have the recording there. Over to you, Dr. Theuri.
So, okay, if Dr. Theuri is not coming up, we can adjourn today, and please look out for the video. So I see ICD 11 is not at all updated. Linda, please note that, because that's something we had really insisted on. The ICD 11 is what we're using and needs to be updated. So perhaps that's why these questions on ICD are really coming up. We need it updated properly. Thank you.
Okay.
Sawa. So asanteni, have a good weekend. And yeah, we'll be communicating more, and look out for the video. For the regional trainings, yes, they will happen. We had already talked to the regional SHA managers through SHA that they should arrange for the regional trainings the way we have been doing in the past. They actually went through this today morning. So look out for the regional trainings also.
Yes, just to add, there are groups per region with the managers, both on the support team and the SHA team. So I think the trainings will start on Monday, if I'm not wrong.
So have a good afternoon, and thank you. Thank you, Martin, and thank you, Dr. Theuri, and thank you, Pius and Linda.
Thank you.
Welcome. Thank you. Bye-bye.
Bye-bye.